demonstrates significantly faster onset of action and greater consistency effect than desloratadine. Levohist provide onset for your patients only half an hour to 45 minutes, while desloratadine provide 2 to 3 hours onset of action. And I think all of you agree with me that your patients need fast onset of actions in order to relieve their symptoms immediately. Levocetirizine dihydrochloride demonstrate magnificent reduction in symptoms of CIU, chronic idiopathic urticaria, and the study نشرت في British Journal and Clinical Pharmacology state that more than 80% inhibition of allergen-induced wheal and flare at most time points when compared with desloratadine. At most time points levocetirizine اللي هو باللون الرمادي ده واللون الأحمر ده هو الدesloratadine. At most time points, levocetirizine provide inhibitions of histamine induced wheal and flare reaction. And I think all of you know about wheal and flare reaction اللي هو الرياكشن لما ندوا البيشنتس foreign allergen بيحصل الانتيجين انتي بودي رياكشنز. بعد ذاك البيشنتس بنديهم انتي هيستامين عشان نشوف the most effective and the most potent for this wheal and flare reaction. The conclusion from the study, levohist provide greater extent for inhibitions for histamine-induced wheal and flare than loratadine, desloratadine, fexofenadine, and ibastine. طيب نسبة للزمن الضيق الاستادي دي انا ما حقدر اشرحها لكم بالتفاصيل، لكن حديكم الكونكلوجن بتاعها اتنشرت في الانالز اوف الرجي ازما اند immunology. كان فيها الكونكلوجن ليفوهيست was the most potent consistently effective in inhibition of histamine induced wheal and flare surface area. And the finding predicts that levohist is the best for treating allergic disorders. Maybe next time أقدر أشرحها لكم إن شاء الله. And also conclusions from this study provide the maximum levocetirizine, maximum inhibitions of histamine-induced wheal and flare reactions when compared with mesolastine, ibastine, loratadine, desloratadine, and cetirizine also. Levocetirizine dihydrochloride demonstrate additional anti-inflammatory effect بالإضافة إلى antihistaminic effect. Significantly reduce the recruitment of inflammatory cell and level of pro-inflammatory cytokines. Significantly reduce the number of eosinophil, neutrophil, and interleukin-A levels. And finally, levocetirizine dihydrochloride offers superior safety profile for your patients. But how? Because levocetirizine unlikely to cause drug-drug interaction, levohist lack of effect on cognitions and psychomotor performance for your patient, levohist negligible penetration to the BBB below than 10% crossing the BBB, and thus for your patients, less sedations. Levohist lack of effect on cardiovascular system, no cardiotoxicity with levohist, and does not affect or cause a ventricular arrhythmia for your patients. Adverse reaction, the most common adverse reactions, more or equal 2%, nasopharyngitis, fatigue, and dry mouth. Drug-drug interaction, levocetirizine dihydrochloride unlikely to cause drug-drug interactions. Those adjustments for renal impairment and hepatic impairment patients, mild renal impairment patients, creatinine clearance from 50 to 80 milli per minute, dose is 2.5 milligram once daily. For moderate renal impairment patient, creatinine clearance from 30 to 50 milli per minute, 2.5 milligram once every other day. Yun bad? Yo. Severe renal impairment patients from 10 to 30 milli per minute, 2.5 milligram twice a week. And finally, for end-stage renal impairment, patients undergo hemodialysis does not receive levocetirizine or should not receive a levocetirizine. For hepatic impairment patients, no dose adjustment for your patients. Used in specific populations like a pregnancy category B, benefit-risk ratio. And for the nursing muscle, because levocetirizine is a racemic mixture of cetirizine will be excreted in human milk, so in nursing muscle, it's not recommended. The acute maximum non-lethal oral dose for levocetirizine, 240 milligram per kilogram in mice, and approximately 200 times the maximum recommended daily dose in adults, and approximately 230 times the maximum recommended daily oral dose in children. In my conclusion, levocetirizine dihydrochloride offer through 24 hours symptoms relief with non-fading effect لا يتلاشى. Your patients ما حيكون عندهم symptoms during the day لغاية 24 ساعة ما تكمل. Next day you can take the next dose. Levohist is the better choice and first-line treatment over a first-generation antihistamine, and this is stated by the Canadian Society of Allergy and Clinical Immunology. Levohist provide outstanding outcome due to unique pharmacological profile. A unique pharmacological profile اللي هي الcarboxy group. The carboxy group, the benefits behind it is less sedations and high selectivity toward an H2 receptor. Levohist demonstrates magnificent reduction in symptoms of CIU, chronic idiopathic urticaria. Levohist is a more overpopular antihistamine in inhibition of histamine induced with nuclear reaction. Levohist demonstrate additional extra effect بالإضافة إلى antihistaminic effect. And finally, Levohist offers superior safety profile and tolerability profile. So there are only one place your patient deserves. Patient using a Levohist levocetirizine 5 milligram in order to improve his quality of life. And now the floor for the question and answer. Next. طيب. شكرا question and answer حتكون at the end. بس دي السلايد دي just for reminding. Joy tab هو التاب of the team. Take your time. Take control with you for premature ejaculations. Joytab is the first oral pharmacological agent selective serotonin reuptake inhibitors approved to treat the premature ejaculations. Joytab has a powerful and rapid effect in the treatment of premature ejaculations. Joytab provides significant improvement in idle time. Joytab improves sexual confidence and psychological outcomes. Joytab improves ejaculatory control and sexual satisfactions. Finally, Joytab enhances relationship and the overall quality of life. Available in Azal, 30 milligram and 60 milligram. And thank you so much for listening to me.